Hi, I'm Dr. Rajiv Midha, and I'm pleased to be speaking about Dr. Klein today. I was asked to speak about Dr. Klein's most significant contribution to the field. And by far, I think the most important contribution he made was to the management of peripheral nerve injuries, and especially the injuries that leave the nerve in continuity. That is to say, nerves that are not divided by a sharp mechanism. So before Dr. Klein, the management of these types of injuries was very uncertain and not in a very sophisticated and logical manner. Dr. Klein introduced many aspects to manage these patients. Firstly, he advocated strongly for a comprehensive clinical assessment and really emphasized the physical examination of the nerve and all the muscles it served, as well as the sensory and pain functions of that nerve to understand the injury fully. The next step was really to decide whether a patient needed an operation, and particularly the timing of the operation and intervention. And he really wrote several papers which exemplified the concept that a delay for a few months to let the injury declare itself was paramount. And during this watchful waiting period, he advocated for clinical reassessment of the patient. Ultimately, if the decision was made to undertake neurosurgery, Dr. Klein was very particular about how to expose the nerve and to do a direct exposure to fully understand the nature of the injury and its pathology. By this careful assessment of the nerve at surgery, the next step he pioneered was the concept of electrically testing the nerve and the nerve injury and continuity at surgery to understand whether it was regenerating or whether it needed a repair. This concept of using a nerve action potential recording really revolutionized peripheral nerve surgery when he pioneered this idea almost 4 decades ago. And over several decades of use, he demonstrated the importance of this technique in particularly excluding patients who did not need nerve repair. In other words, if the nerve action potential was working at nerve exploration, he would not graft or repair the nerve. And these patients tended to have excellent outcomes, as was demonstrated by many publications and also by the book chapters he published as part of his 2 books on management of peripheral nerve injuries and outcomes, along with Dr. Alan Hudson. So I think this was the area that Dr. Hudson helped Dr. Klein in terms of assessing these patients, and Dr. Klein's contributions are huge in this field and have really changed the way we manage patients. So today I was in the clinic and I actually saw a patient with a very severe lower extremity nerve injury, which has been devastating to this young man. And my management today was really along the same principles, where after a comprehensive clinical assessment, we decided that we would offer the patient explorative nerve surgery with the intention of doing electrophysiological testing at surgery, and then deciding based on that whether the patient was going to be spontaneously improving without nerve repair or undertaking a graft repair. I think this leads to the next area which I would like to talk about, which is what is the most important legacy in terms of patient outcomes that Dr. Klein has contributed to. And this is really in understanding the outcome of nerve injury and its potential for patients to have useful function and less impairment. And really, by following the pattern and philosophy of evaluation that I have spoken of earlier, and applying this towards the patients day after day in his clinic and in the operating room, he really demonstrated what the outcomes were in these groups of patients. So if you look over his 3 or 4 decades of work and several thousand patients that he looked after during those decades, based on his own experience, based on his published results, and based on the 2 textbooks that he published along with Dr. Alan Hudson, one can see that they really set the standard for what the outcomes were for management of nerve injuries and what patients can expect in terms of their regaining function. Lastly, I will say that this was his direct contribution, but indirectly through his legacy of training multiple neurosurgeons, whether they were residents or fellows like myself, Dr. Klein left a massive legacy. So over 2 generations, Dr. Klein trained dozens of individuals who have now taken on and embarked on a career where they look after patients with peripheral nerve injuries, tumors, and other disorders. And many of the things that Dr. Klein did are exactly what we emulate today in managing these patients so that they too can have the excellent outcomes and change in their life for the better that Dr. Klein introduced. I think this is the lasting legacy of Dr. Klein, not only in directly helping those thousands of patients, but really the multiple tens of thousands of patients who have now indirectly benefited nationally and internationally from what Dr. Klein taught us. I really enjoyed reflecting on Dr. Klein's contributions, and I miss him like I'm sure everybody else does. And I look forward to a great celebration of life event for Dr. Klein.